नमस्कार दोस्तों। आज का हमारा टॉपिक है कि कोरोना से कैसे निपटा जाए। जो दिल्ली की और देश की जो फ़िलहाल हालत है, तो क्या उसके लिए हम सब ज़िम्मेदार हैं? और जो ज़िम्मेदार नहीं भी हैं, तो एज़ अ सोसाइटी कैसे उसको लड़ें? एज़ अ प्रोफ़ेशनल कैसे लड़ें? एज़ गवर्नमेंट कैसे हैंडल करनी चाहिए? हम लोग जिस देश में रह रहे हैं, जिस समाज में रह रहे हैं, दुःख की बात ये है कि थोड़ी लोगों की यहाँ पे सेंसिटिविटी कम हो गई है आवश्यक मुद्दों की तरफ और उसके प्रति ज़रा भी ध्यान नहीं है, काफ़ी एक लापरवाही का माहौल बन जाता है और ऐसे में आवश्यक ये हो जाता है कि आम आदमी इन सब चीज़ों के प्रति ज़्यादा जागरूक और ज़्यादा सचेत रहे। जैसा कि आप जानते हैं कि मैं प्रोफ़ेशन से डॉक्टर हूँ। संजोगवश काफ़ी कोरोना पेशेंट को डील करने का भी मौका मिला। ये बहुत ही टफ़ टाइम है एज़ अ प्रोफ़ेशनल, एज़ अ पर्सन, एज़ अ फैमिली मैन एंड अ पर्सन हू इज़ लिविंग in a society. Every now and then we hear a news of someone suffering, someone passed away, including very close family members, including even family members of myself. And it's not stopping, it's continuing, it's getting worse, especially in context of India. Now the question is how to deal with it. As long as you understand that this is a dangerous situation, this is contagious, we are in a state of pandemic, and the disease spares none. It makes a foundation for further development of our understanding. Social distancing is one thing, wearing mask is another thing. As a doctor, I have to travel every day to my workplace and I'm dealing without any fear with the corona patients. How do I do that? I have separate sets of clothes which I wear, go to my workplace. It seems very repetitive, very irritating that I'm wearing the same things, but I keep them outside my main house. I would say, like in a little cupboard or box outside, say, my inner entrance of the house, okay, which I change in the toilet or somewhere. When I reach at my job place, I change my clothes to workplace clothes. And while I am coming back, I change it again. Regularly, I wash my hands. If I touch a patient, of course, I wear apron, gloves, and all those protective gear. If I am operating, I have FP3 category masks, face visors, goggles. If I am directly dealing with those patients, I have full body suit. Uh, Even my gloves goes over the handcuffs, and I tape it. Okay. Once the job is done, I discard in a certain fashion, taking the body suit out first, gloves last. In that way, you minimize the contact and the mask comes off the very last one once you have washed your hands and everything. Okay. Once the main mask is down, I have the second pair of mask over my face and then I sanitize my permanent mask if I'm using, or I throw away the temporary one. While you come back, you change your clothes. In the hospital, clean your hands, sanitize it, use detergents, use chlorhexidine sprays, use lotions, and sanitize it. Most importantly, don't forget to wash it. Once you reach home, change your clothes again. Now and then, keep on washing those clothes separately from your regular household clothes. If you have used your washing machine, same washing machine, use some Dettol spray or chlorhexidine spray and wipe it off. So that way it will prevent contamination. Try not to travel in busy public buses. If you are traveling by aircraft, wear your mask all the time. In public spaces, maintain 6 feet distance. It has shown to be beneficial, less contamination. Do not frequent to buy your household goods all the time. Okay, buy the things in one go for a couple of days to last so that you are minimizing your contact. So these are the way so far I'm trying to manage and have managed myself. But the moment your guards are down, it's not only endangering you, but it is endangering your loved one. Sadly, I have posted many of those little clips. No one pays due attention. As a result, they have paid price, sometimes knowingly, sometimes unknowingly. Other times, despite best precaution, we still have danger. In such peculiar situation, which we have never faced in our lifetime, a discipline of hygiene and self-care is of paramount importance. It's very grim time. Most of us have lost one or another relatives or friend. I have lost a couple of my relatives, couple of my friends, couple of working colleagues. It's very disturbing and destabilizing, and it have impact on your mental well-being. So I would also advise all of you, where possible, use some meditations, listen to the good uplifting music, talk to the people around you, not necessarily to seek advice or give advice, but just sharing. There is a say, if you share, you care, and you can be cared. This is the approach I have adopted. I will keep my this video very short now, and there is a hidden warning that even if my family members wouldn't follow uh, the strict discipline, then they suffer also. Some of them are already suffering. Many people don't realize that when they suffer, their suffering translate into the suffering of their loved one. And the chain of spread becomes bigger. If we have to win over the corona, we can't put blame on government only. We have to take some responsibility on ourselves and start behaving and acting. Now, I have no other words, but finally, the advice is that we should have social distancing, wear masks, separate outdoor clothing and enclosure for them outside, hand hygiene, minimize your travel, minimize your contact. In case corona happens, then what to do? Directly or indirectly, I have been involved in care of lots of people suffering from corona. What I have found that if you contact a doctor, get a genuine advice in extremely early stage with rather with the first sign of symptom, the chances of cure are very high. 99% or above, I would say. That's my personal experience. I'm not saying that what is an institutional experience or country experience or a hospital experience. What is my experience is that infection with corona alone is not the cause of mortality or further suffering. It depends on what age group you are, what are your comorbidities, and how in general your health condition is. Okay. Despite all those things, if you start taking some form of broader spectrum antibiotics, it prevents the other infection while your lung, because corona largely impacts your lung. So it prevents other super infection by the other bacterial agents which are in the air. And if we can prevent the bacterial infection, further deterioration of lung due to the disease is less. Second thing is we need to get over the overwhelming body response and maintain the tissue architecture by minimizing inflammation. Most of patients experience a lot of body ache as well. I have found body weight adjusted highest dose of paracetamol very useful for adult in general, a gram 6 hourly, and younger person 15 to 20 milligram per kg body weight. So that's how I have advised people. Use of not necessarily high dose of steroids, but just antihistamines to start with. I have seen has been very successful in the peoples I have come across. like loratadine or just chlorpheniramine. Kids have good tolerance to chlorpheniramine. The adults have done well with loratadine and sometimes a combination of loratadine and chlorpheniramine. Keep themselves not too much hydrated, not too little hydrated. For an adult, just about 2 liter. For kids, just allow them to drink freely. They never overdo in general. Breathing exercises and position on the bed is of paramount importance. I advise them to sleep with the prone position, 45-50 degree of inclined position, so that your most of the lung is not in a dependent position and the chances of edema is less. Deep breathing exercises I always advise. Even if you will do 10 deep breaths every half an hour, it will keep on recruiting all the collapsed alveoli and your oxygen level will be high. I will show you in a minute how to do deep breathing. Okay. And the third aspect is nutrition. I have advised all you people to have good protein rich diet, and that will help to keep your immune level high. Don't overdo with the multivitamin, just simple Vicosul treatment based capsule 1 to 2 maybe just useful. No need to overdo. With this method, so far most of people have been very good. I didn't face any adverse things, and I always top it up, even for my regular patients, that think positive, eat well, drink well, breathe well, move well, you will sleep well. Once you have done this, you will do well. I hope in such time of crisis for the whole humanity, you will understand what I'm trying to say. You will maintain the desired discipline. This is good for you, good for your family member, good for society, country, and in a connected world, actually good for the world. Because one spread of virus from one part of the world to the other part of the world is like back again. Remember that it's a virus which mutates. There is no guarantee that a certain kind of vaccine will work for B kind of strains and it will not mutate. So maintain self-discipline. I wish you all good health and good life.